Welcome back. Addiction is a problem that you do not have to face alone. Now, if you're looking to get on the path to recovery, the organization Renew Health is here to offer support. And telling us more about the services that they offer, we are joined this morning by Trent Carter, who is the founder and CEO of Renew Health. Trent, it is great to have you with us.
Hey, good morning. Thanks for having me. Thrilled to be here.
Absolutely. So let's kind of get into it. Some of the specific services that are offered for addiction treatment.
Yeah, so we focus on substance abuse and the mental health side of it too. So anybody struggling with alcohol addiction, opioid addiction, which would be like fentanyl, heroin, things like that, stimulant, which could be methamphetamine, we help with all that. And so we're medication based, so we use medications to help change the brain. That's going to make it a lot easier to address those problems. And then we also address the mental health side of that. So if it's occurring with depression, anxiety, we're going to help manage that as well.
And unfortunately, I mean, those are some staggering stats that we are seeing here in New Mexico with a rise in some of those addiction afflictions. So right now, let's talk about some of the common misconceptions that some folks might have about medication-assisted treatment.
You know, I would say that one of the primary misconceptions, and one of my favorites, or one that I hate the most, I would rather say, is that if you start taking medication to help with the addiction, is that you're just trading one addiction for the other. And it's simply not true. Okay. So if you come in and we do decide that medication is the appropriate path for someone, then you would be under the supervision of a licensed and experienced medical professional. These medications are coming from the pharmacy. And again, it is backed by science and they're FDA approved. And so a comparison that I like to make is, you know, if someone comes in and they have high blood pressure, we're going to treat that with medication. Mm-hmm. If they come in and they're struggling with diabetes, we're often going to treat that with medication too, along with those lifestyle changes, and it's the same thing here.
What would be like maybe, and of course each case is going to be different, but maybe like a term of treatment, what would that entail?
So duration?
Yes.
So it could vary for anybody, right?
Okay.
I think you have to compare it to how long have they struggled or battled with the addiction. If someone's got a 20-year history, they're oftentimes looking at a pretty lengthy treatment, and it could be something that's potentially for the rest of their life. And so it really does come down to the individual, and we tailor those treatments to every person. So that's a conversation that, let's say, myself and that person would have.
Yeah. So also some specific challenges that maybe even like there for even telehealth, addressing it.
So telehealth is fantastic, especially for the state of New Mexico, because it is so vast and so many regions are in a rural area, and that's where telehealth comes in, because the distance to be able to get to a facility, or if someone struggles with having transportation, it's no problem, because you don't even have to put your pants on. You can stay in sweatpants and I can treat you right there from your couch.
And that's, you know, convenience purposes, that helps a lot for somebody saying, well, I didn't want to, you know, have to go through the trouble of going to seek medical attention. Again, you know, from the comfort of your home, like you mentioned, that can be taken care of.
That's right.
So also, in the course of the last 3 years since its inception, let's talk about maybe a success story that you've seen.
Oh man, countless success stories.
There you go.
Rather than focusing on one individual story, maybe I'll tell you what success can look like. And that's someone not overdosing weekly. That's someone that's able to go back to school and finish their degree or get their GED. It's someone that's able to hold and maintain a job or get promotions within their job, right? It's someone whose brother will now speak to them even after the last maybe 20 years of all the heartache that's happened. And so I see it daily, I see it weekly for countless individuals, no matter what they're struggling with, how far in, how deep they've been, they can make those changes and be successful.
Yeah. Well, what are some of the ways that folks out there can reach out to Renew Health?
Yeah, the easiest way, you could check out the website, which is renewhealth.com. You can call our statewide number, which is 575-363-HELP. That right there is going to be the easiest, just by those two. Or you can check us out online. You can just Google it. We've got social media, Renew Health. Yeah.
All right. Trent Carter, thank you so much for joining us. We appreciate it.
Thank you, sir. I appreciate it. Thank you.
Absolutely.
Making mental health care a priority across the country, more and more people struggle with their mental health. And here in New Mexico, the professionals over at Renew Health are working to change that by increasing access to care despite what is going on in our nation. Here today to talk with us more about healthcare here in New Mexico, and specifically mental health care, is owner and nurse practitioner of Renew Health, Trent Carter. Trent, thank you for being here today.
Thanks for having me.
So there's a lot of changes that go on every day in the day-to-day in our nation, and we need to be in the know, because a lot of times these legislative changes affect us here in New Mexico, maybe in greater ways than in other places across the country. Mental health care is such an important thing, but unfortunately, we're kind of seeing some changes that might be affecting people's eligibility or the coverage they're going to get. So I just kind of want to break that down today. So I'm going to read the question because I want to make sure I ask it right. But I want to know how you anticipate Medicaid, the work and eligibility requirements outlined under the Big Beautiful Bill. How is that going to affect rural New Mexicans that are struggling with mental health or substance abuse disorders?
It could potentially be a massive barrier.
Okay.
Look, these new guidelines that are going to be implemented, it's not that they don't want to do it for these rural New Mexicans, it's that sometimes the paperwork can be very strenuous or very confusing, and if they don't get it done, they could potentially lose their eligibility. And so it is going to be so important to have awareness. If you are someone that may be on that list, look, take action, try to get ahead of it so that way you don't lose eligibility.
What does that look like? May I ask what that means to take action so you don't lose your eligibility? What should they do?
I think first and foremost, they've got to be aware of what all is included in the Big Beautiful Bill.
Okay.
And then if you are someone that's, let's say, the work requirements, look, if you're going to be an adult that's going to fall within the age range and now you're going to have these new work requirements, which I believe is 80 hours a month,
okay,
well, then you need to figure out what you need to do, and especially getting that paperwork in order ahead of time. You still have plenty of time, but there is no lapse in coverage.
Absolutely. So just educating yourself, like you said, on what's in that bill so you can be proactive and not reactive. It would be horrible to find out that you no longer have your eligibility. So the bill does exempt mental health and substance abuse services from new Medicaid cost sharing. Mm-hmm. So with these massive coverage losses kind of projected, is the protection going to be enough to ensure people still can get care?
So I think that the fact that the cost sharing is included in there is fantastic.
Okay.
But look, if you lose your eligibility altogether, you're not going to benefit from that. So again, I think it's great that it's included in there and that he did write about that. But again, if you're going to lose your coverage, it really doesn't do you much good. So again, be aware of what's going on, educate yourself, and then take that action to where you don't fall into that.
Yeah, absolutely. That would just be terrible to find out that you're like, wait, I had this, and now when you need these services that you once were able to, that you no longer are eligible for, that could totally derail someone's day-to-day to be able to have the care that they need. So mental health care providers, they're already in a short supply here in New Mexico, especially in rural New Mexico. Yep. Under the Big Beautiful Bill, is this going to affect our state's ability to get these licensed, therapists or counselors or addiction specialists, to recruit them, to retain them?
My opinion is yes.
Okay.
New Mexico already struggles with that in general. And so now if you have something like this that's implemented to where these rural clinics, they're not getting reimbursed for what the services that they're doing and that they're offering, right? Well, then they're not going to be able to recruit a licensed medical provider to then come into that area. Yeah, I think that there's a lot of things that New Mexico should actually do different to try to increase that. Yeah,
so they're either going to have to drive really far to maybe find someone, or they're just going to have to forego their care.
Unfortunately.
Yeah, okay, so this is a reality that we do not want to see here. So again, starting with the education, making sure that you're protecting yourself, or making sure those that you potentially care about that need mental health care, mental health services, making sure that they know their eligibility and their requirements. Let's talk about maybe some worries that you have regarding the bill and kind of what it means for mental and emotional well-being here in New Mexico. I want to talk about what worries you, but then I'd like to end on a positive note and talk about what you're hopeful for.
Sure. So what worries me is potential mental health crisis. Mm-hmm. If we do in fact have a lot of folks that are going to lose their eligibility, they're going to lose their coverage, now they're not getting the treatment that they had been getting, or if someone needs to get into treatment that they hadn't gotten yet, and now they no longer have the coverage, right? And so I'm afraid that we may see relapses, we may see overdoses, that we may see a spike in mental health crises. And I think they're also going to see the current system that we have being stressed. Because if you see some of these places close their doors or reduce the services that they offer, well, these patients got to go somewhere.
Yeah.
And so now what we have in place is going to be stressed because there's a massive increase.
Well, yeah, and unfortunately, New Mexico, I think, in terms of the medical field, is already kind of a stretched thin space. And so any additional tension is really going to affect the patient, I think, more than anything.
Yeah.
Do you have any hopes?
Yeah, New Mexicans are extremely resilient.
Yeah.
I think that we can find a way to get through it.
Yeah.
I think that we can. Again, I think it's going to be extremely important for that awareness and educating yourself, okay, to where you can, like you said earlier, be proactive and not reactive. Mm-hmm. And fortunately, I think New Mexicans are very good at that.
I think we are a very resilient people, and it's a beautiful thing to see that when things get tough, we don't just lay down and take it. We do find ways to rise above, and that is definitely admirable. Trent, for people that are watching this that are like, I don't know how to navigate what we just talked about, it's a lot, they want to reach out to you. Is there a place online where we can go and learn a little bit more? You have a new book that I know is aimed at helping people in their addiction recovery.
Yeah, absolutely. So renewhealth.com
okay.
is how you would find our clinic. Again, we're statewide through telehealth. We have some physical locations in the southern part of the state as well. We actually have on staff what we call a patient success coordinator. that is very knowledgeable and able to get people on Medicaid. So we're up to date in what's going on and helping folks navigate through this as well. And then the recovery tool belt for anybody that's struggling with substance abuse, for any loved one that has someone close to them that's struggling. This book is full of tips and tricks, and it's going to help save lives. It's going to get people through that.
Absolutely, and help them back to living the best life that
Yeah.
they can. Absolutely. Trent, thank you so much for being here. Thank you for the work you're doing to help
Thank
New
you.
Mexicans. I appreciate it.
Thanks for having me.
Of
Thank you so
course,
much.
Of course, of course.
Out of control wildfires to devastating flooding, the village of Ruidoso has seen more than its fair share of natural disasters the last 2 years. Now, these types of disasters leave many people lost, searching for answers and oftentimes spiraling mentally. But at Renew Health, they want you to know that they are here for you every step of the way when it comes to picking up the pieces and getting your life back together. So we are joined by Trent Carter. He is a nurse practitioner and owner of Renew Health, talking about the natural disasters Ruidoso has dealt with and how they are assisting those affected. Trent, welcome. Thank you for joining us today.
Thanks for having me here, Lenny.
Okay, you're down there in Ruidoso. From your perspective, what kind of emotional and psychological toll are these back-to-back natural disasters having on Ruidoso residents?
Man, it's massive. You know, from the fires last year and then the subsequent flooding afterwards, and of course the flooding that we've had this year, it's had a massive toll on the residents there.
Oh my gosh, yeah, it's been devastating to say the least. The 2024 wildfires, then paired with the 2025 flooding, it's just one after another. Very devastating stuff. Are there any specific mental health patterns that you're seeing that are coming out of this? Maybe that stands out. We're talking PTSD, anxiety, depression. Survivor's guilt is another thing. Are you seeing any of this?
Yeah, you nailed it. So definitely PTSD and anxiety. You know, folks that are now struggling with nightmares that didn't used to, folks that are having panic attacks where they didn't used to. And we are seeing an increase in depression, and I think that we're going to continue to see that as it continues to set in over the coming weeks and months. And then survivor's guilt is very real. You know, someone that wasn't affected, but their neighbor's house was washed away, and then now they're feeling guilty because of that, and it's a very real thing.
Yeah, that can really weigh on you mentally. I want to talk about the compounded trauma because, you know, there can be events where there's one singular event, it happens, it's devastating, but it ends. There's compounded trauma here with the wildfires, then the flooding. How is that having an effect on people as opposed to maybe just one singular event? There's a multiple here now. How is that having an effect on the Ruidoso residents?
You know, when you have a singular event, you can have closure.
Yeah.
And when you have multiple that are coming, and look, Ruidoso's probably not done with monsoon season that's coming. I mean, there's rain in the forecast almost daily, it feels like. And so you never know what's coming. And so you're constantly in a state of fight or flight. And so even someone that's one of the most resilient, you know, individuals, they're struggling and they're finding themselves saying, you know, hey, I don't know how much more of this I can take. Because you are constantly having to live on this edge in this state of alertness of paying attention to your phone. Is it going to start screaming at you?
Yeah, absolutely. Like you said, there's closure with that one singular incident, but we don't know when the next one's going to come.
Yep.
It really weighs a number on your mentals. Can you talk to me about what Renew Health is doing to help those individuals out there right now who are dealing with that depression, the anxiety, the PTSD, the survivor's guilt? What are you guys doing to help?
Absolutely. So we've expanded our hours and our access there. So we've already been treating these mental issues for years. And so what we're doing is we're trying to make ourselves more present in the community. We're trying to let folks know that maybe didn't know that we were around, that, hey, we got you, we can help you out. Even if we can't help you, here's some other resources that are around.
Man, yeah, you guys are there for them every step of the way, guys. If you're dealing with any of that stuff, we're talking depression, the anxiety, the PTSD, the survivor's guilt, Renew Health is going to be there for you. I also want to hit on something that you guys offer, telehealth. This goes statewide. Can you break this down for me?
Telehealth is huge. So if you're in a rural area, or if you're in Ruidoso and now you don't want to travel somewhere because you don't know if the highway is going to flood out, telehealth is a fantastic option.
Yeah.
And it's available everywhere. Again, statewide. It doesn't matter where you are, as long as you've got access to a phone, a computer, a tablet, or the local library, a friend that's got access, anything, you can get the help that you need right there from home.
That's what I'm saying. So you can just basically pick up the phone and make a phone call and start getting the help you need that way, correct?
That's right, absolutely.
Yeah, it's an absolutely amazing resource there, guys. Are you seeing an increase in demand for your services since these incidents down in Ruidoso, and are we able to meet the demand?
Yeah, so we are seeing an increase. So again, for the PTSD, the anxiety, we've gotten a slight increase in demand related to depression due to that, but I think that it's going to increase as these weeks and months go on, and we are meeting the demand.
Yeah.
But I will say there's not enough local providers.
Man.
Yeah, at some point, we'll be tapped just like anybody else, and we're going to do our very best to continue to meet that demand, but there's a lot of really good local providers if you're somebody that's struggling.
I really want to hit on this too with Renew Health, because I think this is part of y'all's mission, is that when someone comes to you guys for help, It is a judgment-free zone. Can you talk to me about that?
Yes, there is no judgment, there is no stigma. We want to meet you where you're at. And what does that mean? I want to make you feel confident that you are at the right place if you choose us. We're going to do our very best to take care of you. By no way are we going to make you feel guilty. It's a huge accomplishment just to take the step to come in and try to work on yourself.
Yeah, we talked about it last time I spoke with you about how when you seek that help, that is not a sign of weakness. Don't let anyone tell you that. That's a sign of strength. Being able to admit that you have an issue and you need the help, that is a for sure sign of strength, and Renew Health is going to be there for you every single step of the way. Judgment-free zone. It's amazing what you guys are doing. Let's talk about the Recovery Tool Belt right here. Just another resource for those dealing with addiction or have family members who are dealing with addiction. Talk to us about the Recovery Tool Belt.
Exactly right. This is just another branch of what we can offer. So the Recovery Tool Belt is for anybody that's struggling. It's for a loved one that they themselves are not struggling, but somebody near and dear to them is. Or hey, even if you don't fall into either one of those categories, but you're seeing it on the news, you're seeing it in the community, and you want to better educate yourself, this book would be for you. And it is to change lives. That's the whole reason that I wrote it. It's full of tips, it's full of approaches, it's full of resources. It's just a wealth of information that can now be another tool that someone can use to change their life.
Yeah, the Recovery Tool Belt's for everyone too. Those who are dealing with addiction, or maybe you have a loved one who is dealing with addiction. This book will help you as well, guys. Trent, where can we find this book online?
I think most folks are going to go to Amazon. But it's everywhere. It's books.com. There's the paperback. There's Kindle. Just about anywhere that you go to buy books, it's going to be there.
There we go. Type in the Recovery Tool Belt online, guys. You'll find it right away. And then where do we go to find out more about Renew Health?
RenewHealth.com.
There we go, guys. Your one-stop shop for addiction recovery right here in New Mexico. And they have that telehealth as well, guys. So you don't have to come if you can't come in physically. And you want to pick up the phone, make one phone call, and will be on the road to recovery with Renew Health. Trent Carter, thank you so much for joining us today.
Thanks for having me, Luke. Appreciate it.
Welcome back. There's a new book out now on shelves that is helping those who are dealing with addiction. It is called The Recovery Tool Belt. It is written by Trent Carter. The Recovery Tool Belt is your essential guide for navigating the complexities of addiction, breaking down the stigmas that surround it, and even building a life with purpose and resilience. Joining us this morning, talking more about the Recovery Tool Belt, why he wrote it, and what he hopes that people reading it will take away from it, is the founder of Renew Health, Trent Carter. Trent, it is great to have you with us.
Thanks for having me this morning. I appreciate it.
Absolutely. Congratulations on this this big accomplishment right here. We've kind of glanced it over, and we've been browsing through it. There is a lot in there.
Yeah.
But what's great about it is that there's a lot in there. So let's kind of give the audience at home a little bit of background on what's in the tool belt.
Sure. So the Recovery Tool Belt, look, I put in there what I see work in practice consistently for these patients. Someone struggling with substance abuse, or if you're a loved one where you don't struggle yourself, but obviously somebody near you is, there's tons of tips, approaches, ways that you can talk with them, and it's just a great resource that's full of education.
What would you say are the two key messages in the book?
Two key messages? Look, I really wanted to empower that reader.
Sure.
And I would like to shift the mindset and shift the approach that we have for someone who is struggling with addiction.
And even for folks that are not struggling with addiction, they may know somebody who is, or may be connected to somebody, or even if they're not, it's still a good resource to kind of go through, right?
Yeah, absolutely. So I'm real big on addiction is not a moral failure. Okay, it's a treatable disease. And I think that when we can accept that and we take that kind of approach, then you can truly help these folks out. And so instead of saying, why can't you change? I think that we should say, how can I help you?
Okay, that's a much different approach. What would you hope that audiences, anybody reading this, would take away from it?
I think what I just said, that addiction is in fact a treatable disease. I think that we got to get rid of the stigma.
Yeah.
Okay, we cannot shame them. I think that we need to come at it from a place of care and compassion, and that way we, again, can truly make a change and help these folks out.
What are some of the practical routines that are kind of discussed in here?
So I talk a lot about structure and routine, daily routine, weekly routine. I think that you've got to have a plan, get something in place, so that way you have a fallback plan, because inevitably the world's going to throw something at us and our day is going to be off. But if you've got that structure and you've got that routine, it's going to be easier to get back on track.
Yeah. How critical would you say it is that there's a resource like this out there now?
Substantial. Yeah. So I think that that's one of the gaps that we have in care, is how fragmented it can be. It's, you go over here to get your therapy, but then you got to go over there to get your medication, and over here for a support group, and that can be overwhelming. It can be very difficult to navigate. And so in the book, I've tried to pull all that into one place where somebody's just got a guide right there.
Yeah. Right now, with some of the resources that are out there, what would you say is probably about one of the biggest gaps in treating addiction?
that it can be so fragmented. Again, that everything's so spread out. It's hard to find everything you need in one place. There's very few one-stop shops, if you will. And so for someone to have to get that roadmap to put everything together and have, how do I do this? How do I get from here to there? What do I need? What's really going to give me the best chance at success here? Is it just therapy? Well, I didn't even know that there's that type of treatment over there. And so I really try to put all that in one place with the recovery tool belt.
Yeah, kind of walk us through it. I mean, what was it like to create this from start to finish?
It wasn't terribly difficult because I live it every day at Renew Health, right? And so I just put what I see work in there. This is not a guideline, meaning it's not a step-by-step process. I was very intentional on not wanting to write it that way because I didn't want to exclude someone that had no interest in a step-by-step process. So instead, what it is, it's a ton of resources and information, all in, 180 pages, I think. So if somebody can take one thing away from it, I think it's a win. Or they could walk away with 30-something things from it.
There you go. Yeah, and like your tool belt, I mean, you've got it all right there and your fingertips.
That's exactly right.
Yep. Trent, where can we find your book?
Amazon's probably where most people are going to buy it. It's on books.com. We've got the paperback. We've got the Kindle version as well. But just go to Amazon.
All right. Congratulations on this wonderful accomplishment.
Thank you so much. I appreciate it.
Well, grounded in compassion and clarity, there's a new book out on shelves that's helping those who are dealing with addiction. It's called The Recovery Tool Belt, and it was written by Trent Carter. The Recovery Tool Belt is your essential guide for navigating the complexities of addiction, breaking down the stigmas that surround it, and building a life of purpose and resilience. So, joining us today to talk more about the Recovery Tool Belt, why he wrote it, and what he hopes people take away from reading it is the founder of Renew Health, Trent Carter. Trent, welcome back to the show. Good to have you here today.
Hey, thank you, sir. Happy to be here.
Congratulations on the book getting out there. This has been a labor of love for you, and now it's on the shelves for people, so congratulations to that.
Thank you.
I want to know about the Recovery Tool Belt. This is described as a comprehensive guide to addiction recovery.
Yep.
What inspired you to want to write something like this?
So often I would have patients come in, or even just people talking about in the community, that they're just getting bits and pieces of help out there. I wanted to put something together that would all be in one place for somebody. I wanted to have something that someone could pick up and say, hey, I can do this.
Yeah.
I can get through this. And so this book is full of options, and it's full of tools, and I think we did a good job at providing folks with that.
Your one-stop shop to recovery right here, guys. And the Recovery Tool Belt, it covers the gamut of recovery, because there's a lot of people that need to recover from a lot of different things. Let's talk about the strategies that you implement in the Recovery Tool Belt, because there's a lot of them. I want to know about which strategies you decided to implement in the book.
Well, I put the tools that work. If it's not something that was consistently making change in real life, in practice, then those tools didn't make it to the book. So everything in there is proven to help folks out.
Yeah, absolutely. Proven things that work, guys, which is exactly what we want, right? I want to talk about the stigma now surrounding, addiction and maybe treatment. The book covers that. How is the book covering the stigma surrounding treatment for those who maybe are out there who need the recovery, and then they have people in their family? There's a stigma surrounding that as well. Like, oh, I don't want to deal with you. You're having to deal with this recovery thing. I don't want to be a part of that. How are you addressing that in this book?
So unfortunately, stigma can be probably one of the biggest barriers to getting treatment.
Right.
And so that's a passion of mine, is trying to destigmatize addiction. And so in the book, look, I address the fact that addiction is not a moral failure, okay? It is a disease. It's a chronic disease. And so I think if people can understand that these individuals, their brain is hijacked by something. Yeah. And if we can realize that and we can accept that, then we can truly make a change. And so I talk about that quite a bit in the book.
Yeah, and also this addiction, it doesn't have to be a life sentence either, right? People can feel so like there's no getting out of this. That's not the case. This is not a life sentence. There's ways to get you back on track. You're obviously doing great work with Renew Health. I want to know about the strategies, the principles in this book, and how you're implementing that into your practice.
Absolutely. So really the practice came first. The book came from the experience of what works in the practice: medication-assisted treatment, therapy that we do, harm reduction, education for either the patient, for their families, their support system. And so that's really what inspired the book, and that's what gave us these useful tools that have proven to work for hundreds and even thousands of individuals.
You've lived it, you're living it, and that's what you're going to get in this book, examples of that and strategies that are going to help. I want to know about maybe a strategy in particular paired with a real life story that you have seen, like where it's worked. It's like this strategy was used on this person and it worked in real life. Can you tell me a story about that?
Sure. So often it's a culmination of strategies. It's not just one approach, and that's where we really do try to tailor to the individual, try to meet them where they're at. And so, one person that comes to mind, we use medication-assisted treatment, which would be the medications that we use. We got them into therapy. a huge component for them was actually their family and educating their family to where they could better support them. And I'm proud to say that 2 years later, she's sober. She's been abstinent ever since. And now what's incredible is she's turned into a mentor for others. So she's given back. And so now it's that ripple effect of how she can help others that are where she was 2 or 3 years ago.
Man, that's absolutely fantastic to hear. Here's a question I have for you, because I think a lot of people deal with this. You know, they have a family member who is dealing with addiction, and they've burned bridges, because that's true. People who deal with addiction oftentimes can find themselves burning bridges with their family members. What would you say to someone out there who has a family member that they want to support, but the bridge has been burned, but they want to be there for them, but there's this communication breakdown that has just caused this absolute headbutting? What would you say to that person who wants to help, but they don't know if they can?
Be patient. Set boundaries, healthy boundaries with your loved one that's struggling.
Right.
And look, you've got to show them that you're in fact going to be supportive. You've got to celebrate those small wins. Those little bitty wins stack up over time. And so often they don't need a lecture. They need to know, hey, I'm here for you. I understand that it may take a while, but you've got my support.
Yeah.
And that can go a long ways.
Absolutely. Patience. That's the key word there, patience. And that can be easier said than done, but it makes a huge difference. Yeah. The Recovery Tool Belt. This is on shelves. You can buy this online now. Talk to me about how we can get our hands on a copy.
It's everywhere. I think most people are probably just going to go to Amazon. You can Amazon the Recovery Tool Belt. There's obviously physical copies. We've got the Kindle. Here in a couple months, I plan on recording, and you can get it on Audible, but it's books.com. It's available everywhere.
Absolutely amazing stuff. The Recovery Tool Belt, your one-stop shop, guys, for everything recovery. Everything. It's a fantastic book. Congratulations on this, Trent.
Thank you.
You're doing such amazing work here in the state. We thank you for that, and just keep up the great work, man. You're killing it.
Thank you, sir. Thanks for having me again.
Absolutely.